Good afternoon, everybody. I think like now, yes, we are starting the webinar. A really warm welcome from Amman, Jordan. Today, we not only have Amman joining us, but we have like two presenters, one from Australia and one from Brazil. And it's not like a warm afternoon, but also like a warm morning and a warm evening to the guests from around the world. Today is the second webinar of our webinar series of altogether 6 events, and under the title of Education for All Learners, Sustainable Approaches for COVID-19 Response in Jordan. Our second webinar is about supporting the well-being of education practitioners, and I'm not sure how you feel, but honestly speaking, after the really stressful and busy months lying behind us, I think we all can use some well-being. So it's good that we have the topic on this agenda now. Before starting, I would like to give you some webinars, house rules and logistic, but also like my name is Stephanie Petrasch and I'm the GIZ head of like the education projects in Jordan, and also I'm the project manager of the Promoting Quality and Inclusive Education project. So our language is, as you can see, like I speak English. We will also have presenters in Arabic, but you will see, probably already see it, we have live captioning is taking place in English. We have also a sign language interpreter. Thanks, Julia, for joining us also this week. And we have simultaneous Arabic or English translation on our YouTube live stream, and you find the link in the meeting chat. My colleague Lilia already posted that one. So once you want to listen, like you're an English speaker like me, you can also listen to the translation once we have the Arabic presentation, or vice versa. If you want me to listen me now in Arabic, you also switch please to the YouTube stream. The presentation will be only available in English for today, but after the webinar, we will have them also shared in Arabic. So if you have during the webinar or afterwards, because we strongly encourage people to engage in our webinars, if you have any questions or comments or want to share some information with participants, please use the chat. So audio and video function will be switched off for all participants. And we will have always, like in the webinar, during the webinar, have time to sum up different comments and facilitate some of your questions. The webinar will be recorded, so I hope everybody agrees to the recording. If you don't agree to the recording, you unfortunately have to leave, but we're doing the recording because then everybody who joined, but also like everybody who couldn't join, have the chance later on to look at the webinar again. And we will post it on different websites of our partner websites, the Higher Council, but also the Ministry of Education. And we also have some Facebook channel of our project. So we will make sure everybody can listen to it later. So our webinar is divided into 2 parts. The first part is like 16 minutes where we will give the chance to our presenters to have them sharing their knowledge and expertise and experience with us, and then we will have a dedicated 30 minutes in the end where we have additional space for discussion and question. But please, immediately, like from minute 1, you can use our chat, and we're trying also to interact to you. So today we have just like I'll give you a short presentation to who we have today. So we have our colleague Dr. Musa Ghoniemat from the Ministry of Education, who today joins on behalf of Dr. Samima Hassis, who had an urgent appointment. Thank you for Dr. Musa for jumping in. We have Ayman Qwaider from the Interagency Network for Education and Emergency, you joining us from Australia. We have Dr. Marcio Gagliato from the Mental Health and Psychosocial Support Network, you joining today from Brazil. And we're having Dr. Zuhair Zakaria from the Higher Council of the Rights of People with Disabilities, and he's joining me from Jordan too. So I just like maybe to, before we jump in, just like also to give you a bit of the background again. I mean, the idea came up when we all were locked down, and as some of you know, Jordan launched in February a 10 years inclusive education strategy, and we had a great event around that one, and a lot of people have been, organizations have been really committed, the Ministry of Education, the Higher Council committed to the strategy, and we started to work in the implementation, and then the lockdown happened. And I mean, like it always is, I mean, like you probably, Ayman, can also tell us, like in situation of emergency, and it was like kind of an emergency situation, schools have been closed, people were at home, usually, especially the vulnerable people have been forgotten, vulnerable people's children. So, and we also saw that one happening to children with disabilities in schools and outside of schools. And so we kind of saw like what could we do to also like again highlight our inclusive education strategy and bringing it back to the agenda. And this is like how the webinar series was developed. So, and we also decided, because like the strategy is like just recently launched, that it's also nice to have different experts from different parts in the world who already have maybe more experience already to create like a kind of network and a cooperation between the different stakeholders. So it's really glad that we have all these different presenters today, but also in the other webinars. So let us talk about some well-being today, and but before starting there, I would like Dr. Musa, who is the head of the Department for Students with Disabilities Programs in the Ministry of Education in Jordan, I would like you to open the floor for you. And Ali, maybe you can just like show Dr. Musa for the participants so they have a face. Because it's always, I think, easier if you see also somebody, not only hear the voice. Unfortunately, we will like again switch your camera off, because so that we can see Julia for as our sign interpreter. So I'm sure now you see Dr. Musa, and Dr. Musa will start again with a presentation framing our today's webinar under the umbrella of the 10-year strategy for inclusive education. Dr. Musa, the floor is yours.
مساء الخير للجميع. نكمل الحديث عن محاور الاستراتيجية العشرية للتعليم الدامج 2020-2030. نتحدث اليوم عن 3 محاور رئيسية، وهي كل المحاور تعتبر رئيسية ومهمة. محور التعرف والتشخيص والتقييم، وهو محور للتعرف على الطلبة ذوي الإعاقة والتوصل إلى تشخيص دقيق لإعاقاتهم، وكذلك القيام بتقييم النفس التربوي والأكاديمي. من خلال هذا المحور تتطلع الوزارة لاستحداث قسم للتشخيص في إدارة التعليم، مديرية برامج الطلبة المعاقين، وتأسيس 3 مراكز ثابتة في الأقاليم ال3 ومركزين متنقلات. بالنسبة للمحور الآخر، محور إمكانية الوصول، اللي هي تهيئة البنية التحتية للمدارس والمرافق التعليمية وفق كودة متطلبات البناء للأشخاص ذوي الإعاقة. وتم حصر المدارس المهيئة للتعليم الدامج التي أنشئت على منظمة USAID والمنح، وقد تم حصر هذه المدارس حتى يعني نتمكن بالبدء من هذه المدارس. الهدف من إمكانية الوصول العمل على زيادة عدد المدارس الدامجة، وكما سبق البدء بالمدارس المجهزة والمهيئة التي تم بنائها حسب متطلبات الخاصة للأشخاص ذوي الإعاقة. بالنسبة لمحور البحوث والدراسات العلمية وقواعد البيانات، وهو الهدف من هذا المحور اللي هو تجهيز قاعدة بيانات خاصة للأشخاص ذوي الإعاقة الغير ملتحقين بأي خدمة تعليمية. المحاور الثلاث، الهدف من المحاور الثلاث، الأول القيام بالبحوث والدراسات لعمل قاعدة بيانات كاملة، ومن ثم إنشاء مراكز تشخيص لتشخيص هؤلاء الطلبة، وضعهم في المكان المناسب. والمحور الثالث اللي هو تهيئة المدارس حتى تستطيع استقبال هؤلاء الطلاب. اوكي، شكرا.
Yeah, thank you, Dr. Musa, for the presentation. I hope, sorry, I was also listening parallel in the YouTube channel, but that was probably the little gap. So thank you for introducing us again to the education strategy, and for everybody interested in that one, we can also share the link to the strategy or share with you also the document. I'd like to introduce you our next speaker from Australia, Ayman Qwaider. And he is actually not only a professional in well-being, but also a qualified teacher himself and an inclusive education consultant. And you have almost 10 years experience in inclusive education and education in emergencies. And you currently work for the Interagency Network for Education in Emergency. And you also the Arabic language community facilitator. So probably, Ayman, you could do it in both today, isn't it? But you do it, we agreed that you do the session in English. And I know also your network has started to do some webinars, really interesting webinar series already. You started also off with English, and then you had also some Arabic speaking webinars. And which was like a really helpful resource too. And yes, and you are a global network, and you're sharing a lot of information. And I mean, I have to say, and also my team have to say, we also had a lot of your tools and publications you developed. We also use them by ourselves. So I'm very interesting to listen to your presentation now, and the floor is yours. And Ali, maybe you can also give our participants a little like how Ayman looks like, so they can see he's very real. And maybe we can then also unstop showing the presentation of Dr. Musa. Thank you. So Ayman, the floor is yours.
Thank you so much, Stephanie. Can you hear me all? All good?
Yes, we can hear you perfectly.
Yes. Excellent. Yeah, if there's any problem, just let me know and I'll do anything with technicalities here. Thank you so much, Stephanie, and it's a really pleasure to be here. Marhaba all, and first of all, I would like to thank the GIZ and for inviting me to take part in this invaluable webinar, and it's really an honor and a pleasure to be speaking in this webinar alongside Marcelo and other colleagues from the Ministry of Education and the other education stakeholders in Jordan. My contribution today for this webinar let me actually first also share my screen, just to, okay, let me see, share screen. Can you all see my screen now?
Yes, we can see it now. Thank you.
Okay.
Now it seems to be off again. I'm not too sure.
Okay. Sorry, let me just do it
worry.
again. Can you see now? What can you see in the screen now?
Yes, we see now I think the starting, the first starting page, mental health and inclusive education, and your name and the date.
Excellent, excellent. Thank you so much. Thank you much, Stephanie. As I said, my contribution today in this webinar will basically focus on the important aspect of inclusive education. This aspect is often not given that much attention in our classrooms or our education communities. This aspect is the mental health, which I believe strongly that not much attention is given to this aspect of mental health when it comes to inclusive education, and I strongly believe this has to change. I will try to make my presentation as practical as possible and as relevant to teachers and educators, stakeholders in the field of education, inclusive education, and inclusion in general. My presentation will basically discuss some of the common wrongful assumptions regarding mental health issues, and how these are related to inclusive education. How can we find the connection between mental health and inclusive education? And I really hope that this will stimulate discussion around this important topic. My presentation today aims to be more of a conversational contribution rather than just a webinar or a presentation. So please feel free to shoot any questions you have in mind, or comments, or remarks as I present to you today. Before I embark on my presentation today, I would like to ask a question to each one of us in this webinar, including the participants, the Ministry of Health people, each one of us. Basically, I would like to know when was the last time that you have had conversation around the topic of mental health in your education environments? Would that be in a school or a training or the Ministry of Education or local community groups? When was the last time you had an honest conversation about mental health when it comes to education? So if the answer is yes, please write number 1 in the chat box. And if the answer no, I've never had this conversation, please write number 2 in the chat box. So I'm going just to give like 30 seconds for this quick exercise, just for us to reflect honestly on when was the last time that you have had a conversation about mental health in your education environment. So the question is, when was the last time you had a conversation about mental health in your education environment? Let me check the chat box. That's good. All right. Let me carry on. So I will let other people and participants to continue reflecting on these questions as I go through the presentation. So my first of all, I would like to start with two two stories of two students that might humanize and personalize my presentation today. These two stories are based on real life stories told by parents and teachers and NGO workers through the work that we do in Asia and Africa. We picked up the names and the countries and we hidden their identities to protect them, but they are actual reflection of real stories in happening in Asia and Africa, in particular education environments. The first story is for a learner by the name of Adhi. He lives in Indonesia, and his father left his family last year when Adhi was only 9 years old. No one knew where the father has gone. So at that time, Adhi's grandparents told him that he has to start looking after his mom and the sibling, and he is now the man of the house. At the beginning, Adhi was so proud of himself, and this is an important role that he would like to play. But later on, things become really tough at home, and the problem with money started to erupt and to start. And this learner, Adhi, began to feel increasingly anxious and stressed. He had several panic attacks inside his school, which has led other people to laugh at him. He was very embarrassed, and this has further increased his anxiety. Now Adhi will not speak to anyone, and he refuses to leave house or even to go to school. This is the first story. The second story is for a learner by the name of Rihanna. Rihanna is from Malawi. Malawi is a territory or a country located in southern Eastern Africa. Rihanna was or still like 14 years old. She started to hear voices inside her head for a long time, as long as she remember. When she was small, her parents told her that this is probably just an imaginary character or imaginary friends, like many friends and many children do. However, when Rihanna got older, she realized that this is not the case, that there are not only imaginary friends talking to her. Sometimes these voices were extremely loud inside her head, and she could not make them stop at all. She would be unable to sleep for days, and this has negatively impacted her schoolwork. At the school she faced regular kind of punishment and bad treatment just because she failed to complete her homework or pass the test. In the last few months, these voices inside of Rihanna's head asked her to kill herself, just to end up her life. Rihanna is so scared now, and one night, in order for her to overcome these voices that have become very frightening, she decided just to start drinking and smoking and try to calm her situation, to try to quieten these voices inside of her head. Now she tries to steal alcohol from families and neighbors as much as possible, just to continue quieting herself. So the lesson learned here is that Adhi and Rihanna, both students, both learners, are different children living in different places, but they both experience mental health problems, mental health difficulties. Adhi's increasingly severe anxiety started when his father left the house, and Rihanna lived with these voices inside her head for a long time. Both the children experience mental health problems, which is pretty much frightening and have a serious impacts on their education performances. One would imagine how many children across the world, like Adhi and Rihanna, who experienced the similar experiences with a wide variety of mental health issues. But what we see is that these difficulties and experiences are often not recognized or even addressed inside their schools, their communities, or even within their own families. Of course, here, while disability issues are increasingly being discussed and addressed in the education sector, and also in wide society, mental health issues continue to remain hidden in stigma and misunderstanding. There is little understanding of mental health among families or communities or even in schools, which basically has led to negative attitudes, which we really want to address all throughout the inclusive education projects as we implement them. And fear regarding families, members, and or learners with mental health problems. Education staff specializing in supporting learners with health and disability often lack the knowledge, the skills, the confidence to provide support to those learners who experience mental health problems, not only for them, but also for their own families. I must say that the progress being made around policy and practices for disability inclusive education often wrongly excludes mental health. And I must say that this has to be urgently readdressed, the issue of mental health when it comes to inclusive education and disability inclusive education. So in order to make a progress, I would like to discuss with you today certain myths and misunderstandings that needs to be addressed and broken down, and we have to have an honest conversation about these issues, because they are deeply related to us as inclusive advocates, as inclusive teachers, to discuss. The UN Convention here, and I would like to talk about this issue because it provides us with that legal framework for the work we do. The UN Convention for the Rights of Persons with Disabilities, in Article number 1, clearly states that persons with disabilities include those who have long-term physical or mental or intellectual or sensory impairments, which is in interaction with various barriers, may hinder their full and effective participation in the community, in the society that they live in an equal basis with those living in the same community. I would like to underline the word include, which is mentioned in the UN Convention on the Rights of Persons with Disabilities in Article 1, which is basically giving examples of what amounts to disability. So disability is not defined in details in this convention, as we see, which basically allows individual countries like Jordan, like most of the world countries who signed on the convention to be able to have considerable liberty as to define the disability in their domestic laws. However, the Committee on the Rights of Persons with Disabilities has explicitly stated that persons with mental illnesses, and which basically refer in their convention as psychosocial disability, fall under this convention. So basically, it's really important to acknowledge that this persons with mental health problems or issues or mental illnesses does fall under this convention. So let's now embark on unpacking some of these myths and some of these myths and wrong assumptions when it comes to mental health and inclusive education. The first assumption here is that mental health issue is an adult issue. And that's basically not true, because anyone in any age can basically experience mental health problems. Unfortunately, mental health difficulties in children and adolescents can be misinterpreted as bad behavior or naughtiness or typical teenager. Even in some of the Arab worlds where I come from, they call them crazy people. And I hear that my own ears when I was little, that when we look at a person with mental health issues, sometimes we chase him, sometimes we call him crazy, and that's basically it's a serious issue that needs to be addressed. And we will talk later on about the attitudes and taboos and all of that. So often mental health difficulties emerge and become established in childhood or adolescence, but this may also, if it is not diagnosed or unsupported, it can go long, until adulthood. According to UNICEF, just a quick statistics here, up to 20% of adolescents globally experience mental health disorder. Suicide is the third leading cause for death among people from the age 15 to 19 years old. And 15% of adolescents in low and income countries have considered already suicide, and which basically may include some of the countries in MENA region. Assumption number two, some believe that only learners in emergency context face mental health, and that's not true. Mental health is something that any learners living in any country can suffer, can experience. Children with young people living in crisis and emergency and conflict situations definitely may face a greater risk of abuse and violence and trauma, which impacts their mental health well-being. They may face greater challenge in getting their support and learners needs related to mental health recognized and addressed, especially if their mental health difficulties are long term rather than just direct resulting from a trauma or crisis and conflict. But with no means that all learners with an emergency context experience mental health issues. Everyone could experience this. And of course, they need, if they experience this mental health issues, they need support in their education environments. I'm not sure how I'm doing with time. Stephanie, please stop me when I have to finish. I have a few more slides to go through, but they're really important that I would like to share with all of us here. Assumption number 4 or 3, mental health is an issue for doctors and not for schools or teachers. And this is a very important point that I need to spend some time in here to discuss. We know very well that's not, of course, this assumption is not true. We know that teachers play an important role in helping identifying children's needs. We don't expect teachers to be medical experts, and we don't expect them to diagnose health issues or disability or impairments. So this is exactly what part of the answer to your question, Stephanie, later on when you ask what can be done at the school level also to address inclusive education health here, or inclusive education. We know that and that inclusive teacher can constantly observe his or her own learners and notice if there is something right or wrong happening there. Inclusive teachers can actually spot the signs that learners may experience in their classrooms. For example, students suffering or experiencing problems or difficulties of seeing, hearing, understanding, communicating, moving, etc., etc. These are all signs that teachers, our inclusive teacher, can report. And teacher know when and how to seek help and advice, as well as how to work with families to better understand and support learners' need. And I can't emphasize enough here about the importance of collaboration between school environments, between families, between education stakeholders, between local communities. These are all actors that are really important when it comes to the helping children with and without disabilities to realize their educational dreams. In the same way, inclusive teachers can and actually should be able to notice when learners is showing these signs of mental health difficulties, and also can take appropriate steps and measures to find the necessary support for those learners with mental health difficulties. Teacher need inclusion-focused trainings and support that includes mental health issues, and this is one of the problems we always encounter as education specialists, inclusive education specialists, is that mental health is rarely talked about in our training manuals, in our training delivery, whenever we ask to do that. We know that teacher can facilitate classrooms that support positive mental health, and the use of language that is void from stigma and judgment. For students with diagnoses, teachers should collaborate with their parents and healthcare professionals for so many reasons. One of them is just to be able to minimize the stigma and the use of bad language and judgment for those children, which basically negatively affect their educational performance. Also, what I want to say is that students with mental health illnesses who are undergoing a treatment will need supportive educational environments that is free from stigma and also provide necessary accommodations. And we will talk later on about what do we mean by accommodations here.
Ayman, I just wanted
yes.
to say you have like only, I mean, like you're a bit over the time, but I didn't want to stop you. It's really interesting, but maybe you can really like in the next 2 minutes.
Absolutely. I have probably I'll try to be as I try to slow down my presentation just for the sign language and the translation, but I can stop in 2 minutes, and we can touch upon other aspects later on. But this is another like slide that I really would like to share with the participants here, is that mental health usually perceived in our world is that it is not an inclusive education issue, which is basically not true, because we know that inclusive education is not only about including learners with disabilities, but it's also about ensuring that we tackle every barrier to access or to participation and the achievement that's faced by every learners, whatever their status are or their background are. There are a number of issues that impact on learners' attendance and participation and achievement. First of all is the prejudices and the stigma surrounding mental health, the disruption of mental health or physical and mental problem that can bring to an individual's life, which basically impact their self-esteem and confidence and motivation. So the barriers to access and to participation and to achievement for learners with mental health difficulties maybe more covert or less acknowledged or hidden in stigma or embarrassment or taboos. But this even gives us a greater motivation to ensure that their rights needs to be addressed through inclusive education. Assumption number 5 is that teachers need to be specialized and have a lot of training before they even provide mental health solutions or diagnose these problems in their classroom. And that's basically not true, because we know that there are chances that every teacher in his or her own class may have children with mental health problems, but perhaps without a realization, or even they may have assumed that these learners exhibiting bad behavior. So each class may have children with students with mental health problem, and we know that teachers don't have the disability or medical experts to teach children with disabilities. Equally, they don't have to be mental health expert or doctors to teach children with mental health difficulties. I want to say here is that good teaching practices are needed, such as 1, observing early signs that learners is experiencing problem. 2nd, understanding each learner's interests, needs, background. 3, working with families and other resources wherever exist to develop this individual and educational support plan. We don't expect the job to be done only by teachers. Teachers do play a fundamental role in their classrooms, but there should be a collaboration effort here between the leadership of the schools, between families, between local community organizations. We talk about clinical health. Whenever students need a referrer, they can be referred there. Collaboration between teachers and the school environment, as well as the local community, in order to ensure the service delivery for those children who suffer from mental health problem. How am I doing with time, Stephanie? Do you want me to stop here?
Yes, maybe you can just like sum up a bit, and then we will also share the presentation later. Thank you, Ayman.
Absolutely, yeah. Absolutely. Yeah. Absolutely. I really have probably another like 10 minutes. I'm sorry about my lengthy presentation. I think it's really important topic to be discussed. Happy to share my presentation and to further this conversation with you guys. But I would like to conclude by saying that the topic of mental health and inclusive education is more extensive of what I'm covering in this presentation. And as I said, it's only a scratch in the surface. But we hope that this is just a kickoff for some more discussion and honest conversation around the issue of mental health and inclusion and so on and so forth. I didn't have the time to touch upon the aspects of social and emotional learning, the SEL, and as I was asked by David and the GIZ, I'm happy to do that in the future. But it's really an honor to be with you today. Thank you so much for giving me the opportunity to address you on today, and I look forward to the rest of the speakers and more interactive webinar. Thank you.
Okay. Thank you, Ayman, and thank you for your presentation. I think it was good also to start again, giving us again like what does it mean and how does it reflect, you know, mental health in children. And I mean, like we also know, especially a situation like we had in the last months is of course putting extra stress, and maybe mental health issue might also raise from that one. So thank you again. I think it's really relevant. I want to go, please start posting in the your questions. They are not forgotten or comments, but we will jump to the next presentation and then have and to the next two presentations, and then we will give some time for all your question answers and comments. So the next presenter is Dr. Marcio Gagliato. I was introducing you before. You are a psychologist and you have an extensive field experience. I was like quite, and I don't name all the countries you worked in, all the organization you worked in, because like that would take another extra 10 minutes. But you have been since 2015, you have been part of the Mental Health and Psychosocial Support Network, and with the lead responsibility for supporting ongoing situations of conflict, disaster, and poverty. And yes, for the last 15 plus years, you worked with really several organizations and in many different countries. So it's great to have you today. You're joining us from Brazil, and I think you work there for Save the Children, isn't it? Or
yes, I also here for Save the Children.
Yes. And I can see, they can see you now for a minute before we switch to your presentation. Right. So you get also a face behind the voice. You will listen in the next 10-15 minutes. Marcio, the floor is yours. Thank you for joining us today.
Thank you very much, Stephanie, and assalamu alaikum to everyone. It's such a pleasure to be part of this webinar, and I'm very grateful that you invited me. My greetings to you, Stephanie, GIZ, Dr. Musa, Ayman, and Dr. Zuhair, Zakaria as well. I will spend these few minutes here just sharing some reflections. Let me just make up my, and I'm with my fingers crossed here that the technical part of this will really help. It will really help. So I'm trying to upload my presentation, but when I press share my screen, it doesn't go. So to be quicker, can you guys try to upload on your end the presentation I had?
Yes, so maybe just like try to press the button again, but I think we also have the presentation, so we can also try to do something in the background, but I would recommend you to start even without the presentation now showing, and then we try to help you with that one.
All right, sounds good. Thank you very much. Sorry for that again. I'm pressing here the button, but it's not going. It's Microsoft. And it's the ghosts around webinars. They are always ready to get us when we start. I think many of you know this experience already. So let me start with some initial considerations.
Now.
You have my presentation? Okay, so I am going to the initial considerations, which is the slide 2, and I will ask you to pass it as I speak. Okay? So basically, I think I want to start with it has been such a great introduction that Ayman he has done because basically he introduced to us some key concepts. You know, I would start saying that some initial consideration that I think it's very imperative. Is the first of all is that dealing and coping with this whole situation. We are in the middle of this challenge. You know, as I speak about well-being, it's tricky because at the same time I'm also part of this, let's say, emergency, which is when we go to the field, when I go to a country living in an emergency, I'm in a position where I'm acting to support others. And at this situation, I'm also affected by this whole situation. The whole globe is affected by this whole situation. And I think one of the key aspects that Ayman he gave to us now is that we need to understand the value and the importance of our own well-being to the well-being of the population, to the well-being of the persons around us. And that is a consideration to take, which is not normally giving such importance in many places, but I'm really glad that at this global crisis, at this pandemic, we have a very good. We are having let's say an important consideration starting to grow, on our mental health and psychosocial aspect, in our own well-being, the impact of the COVID-19 in our own life and at our own work. The United Nations director, not so long ago, he had made a very important contribution to this topic, saying, put at the center of the discussions, the consequences and how to cope with the mental health aspect of this whole situation. Yeah. So this is the first step. Is really to take this in consideration. The question that Ayman did here, I could see that the group half of the answers had some conversations about mental health at the school, whilst others they did not. So that is the first step. Is to take that as an important consideration. As a normalizing aspect of coping with the situation at the moment as well. Not only at this moment, but particularly at this moment. You can go to the next slide. And it's also as a fundamental consideration for this presentation. It's understanding that each of us, we have a very crucial role fighting this pandemic, and at the same time acknowledging that it's a very unusual situation, and so how to help ourselves can really help others in that sense. The impact of the COVID-19 and the situation that we're having now, I would say that of course, men are facing many demands, but there are two common aspects that I think many of us can share. One is the aspect of fear, and the other is the anxiety. How many of us here have passed the day concerned or worrying about our loved ones, our family members, that they are part of the risk group, or the ones that are our colleagues, ourselves, our sons, our grandparents, our parents, and also the anxiety of this stage of uncertainty that we have at this moment in the whole world. What's going to happen? What we lose the sense of control of that we used to have somehow. So and at the same time, not feeling in control of the situation to protect the loved ones. We are learning about this virus. We know few things so far that can protect ourselves, but we don't know everything. We're learning by doing. It does create in our mind, creates a higher demand of our mental health, in that sense, of our feelings, which can be sometimes quite overwhelming for many. There are lots of research saying how much the lockdown, the quarantine, the media saying every single day the complexity of the situation in the whole world, those scenes that are really dramatic, we getting to know about stories and the loved ones that are closed ones that are being affected by the virus. So this is an overwhelming experience for sure. So, but it's not only about the COVID-19 as well. It's also related to the ongoing personal stress. Now we are facing in so many places in the world, and there are important campaigns about home violence. I mean, previous issues that are now being exacerbated because of the lockdown and because of the forced situation. Especially in developing countries, they struggle with the economy, the job losses, and all that fear around. And one aspect that is part of any emergency, which is a subject of social studies, is also the misinformation, the level of misinformation during the pandemic. It goes really around. And so I'm not going to go through here what stress is, but we know that it's stressful, and it's also important for us to get some information of sometimes it becomes difficult. All that I spoke just now, sometimes that is really difficult to focus. We get angry easily. Some might have difficulties to sleep, might feel sad, might cry, might feel tired. But then I hand over this to each of us to be aware of what are our own signs of stress. And I would not make this question here, but it's for yourself to reflect what you identify as your own sign of stress, which is the first step for self-care. No, being aware of ourselves, what can be knowledgeable of how we react to such difficult situations. But then I want to remind you about few important aspects. Yeah. First is that there is not a standard model of people reacting to stressful situations. People, they will not react in the same way. So some people, they might, and that's for any kind of difficult situation. And that's not a sign of weakness for the ones that feel the stress, the consequence of stress in a much more difficult way, or the ones that apparently don't feel so much the reactions of the stress, or don't show that very much. So it's important to take a consideration that it's not a standard, like this is how people will react. That doesn't work for mental health and psychosocial aspects. And it's also important, and I think this is one of the core aspects of this presentation, which is how this whole experience can be a very transformative experience for everyone. Not only as a society, we are learning here so many different ways of adapting to the situation, and in creating perhaps or reflecting our previous lifestyle as a society, as politics, as economy, as public health, but particularly on the way that we as an individual can be transformed by this whole experience. And this is a core aspect that it's similar to what we call as resilience, is when we face a challenging time, what are the new aspects that, because of that challenging time, that is challenging our existence, that is challenging what we are, that is challenging our feelings, that is challenging our sense of control, our sense of normality, can give us as well as an opportunity to change, as an opportunity to transform. And that's why that often in the clinical work, many people, when they face stories and situations that are for ourselves unbearable, we cannot even imagine the struggle, they somehow find in the process of that very difficult experience a source of transformation that they almost reborn. So they gain strength with that experience. And I think this is very important to stress out here at this presentation, because we keep some of the messages are how this whole situation is going to impact us in a very negative way. It's going to affect our mental health. It's going to affect our well-being. And we don't necessarily, it's giving that importance of how much that can be a powerful transformation experience for some. But remember that when the stress is too much, and when I say it's too much, it's stopping you to do your daily activities, then it's a sign that you need to look for a professional support. Which doesn't mean that you have a bad day. No, you need to go to a psychologist or to a psychiatrist or to a professional. It just says that when the bad days are too many days, and you're struggling too much in coping with the day-to-day life, then is the moment to look for support. Then two more slides here, and I'm gonna finish. The role to protecting the mental health in that sense is of course yours, it's mine, You know, it's our own responsibility, but also the responsibility of the colleagues around us. It's also the responsibility of the persons that works together with us, but also the community as well. And some practical tips to promote the well-being, I would call, it has been said about the social distancing, which I think it was a bit of a mistake the way that it was phrased. We should stress the need for physical distancing, but we should say the importance of the social connection. So social distancing, physical distancing is not the same as social connection. So it's important this time we do connect with the loved ones. We have a buddy system. We can talk about those things, and we can make a central discussion as well, our own well-being, how people are coping with that, and also understand that we are. This is not a topic for specialists, as Ayman well said. The majority of the population will benefit greatly by people, common people, very common people from the communities that are engaged with the well-being of others, in supporting others. And that's a very important contribution from the global field at the moment, that we are decentralizing from psychology, psychiatry, social workers, and to understand that the majority, and I mean really saying that at least 90% of the work in this field can be done by lay professionals or lay people. And there are several materials for that, psychological first aid. It's really knowing how to listen, how to support people around us. One thing that's very personal, what helped you in a very difficult moment in your past, is to remember the source of energy and motivation also that you found in a very difficult moment in your life for the moment now, and bring that back to feed you again energy and hope. We don't know yet how far the situation is gonna go, and what it's gonna turn. If it can go really to very positive change in the road, but it can also go to very difficult situations. And I think the moment of real challenge, there are also moments of big opportunities, and connecting to our most fundamental values in life can be a very great sense, give a great sense of energy and motivation for us and hope. And to finish, most of the common myths Ayman already said that I want to tell you, but I just want to highlight here some existing tools and resources very quickly. All those materials that you can see here in the presentation, they are designed, we have created specifically for this situation now, during the COVID-19. So basic psychosocial skills, you can have, it's translated to Arabic. Doing what matters in times of stress is translated to Arabic as well. And I will give you here this MHPSS COVID-19 toolkit. Probably many of us are overwhelmed with the number of materials we have in the field now. It's coming every day, hundreds of materials, dozens of materials everywhere. So at MHPSS.net, we have a team that mapped them out and curated them in different topics, and we created the toolkit. Today, we just launched the version 2.0. So it's the most updated toolkit that we're launching today. You can download it, and I can share to Stefan and the others after the presentation to share to everyone that's been part of this presentation. But also you can download it at mhpss.net. It's a toolkit where it's curated several documents, more than 300 documents in different topics. There is even one about education in COVID-19. I'm showing you in the next slide, where we have created some of the documents. It's not documents that we necessarily recommend. It's just a number of documents that we curated. So we organize it for people to find it easily in different topics related to mental health and psychosocial support and COVID-19. And I finish here, shukran. And let's pass, I really try to keep it 15 minutes, but I passed 3 minutes here, I can see. So thank you, everyone.
Yes, thanks a lot, Marcio. And maybe you can switch off your microphone now, because sometimes that creates an echo. Yes, thanks a lot. I guess, like, you know, last time we were really good in our time, but this time we have a bit of an, we take a bit of an extra time with the presentation, but because we plan to do the webinar anyway to 4:30, so we are still fine in the overall time frame. And I would like also to hand over to our last presenter today. And great to have somebody also joining me in Amman, Jordan. I guess you're in Amman, isn't it? And so for our last, what we call like voices from the ground, because like the webinar series is looking on how we can take different experience, knowledge, resources into the Jordan context and helping us to implement the 10 years inclusive education strategy. So I'm really glad that you, Dr. Zuhair, are today also joining us in the webinar series. You are an independent counseling psychologist and a mental health specialist. You're working for the General Secretary of the Arab Psychological Union. You have a professional, you're also a professional consultant, but trainer, local, regional, and within multinational organizations. A board of the trustees members of the Higher Council for the Rights of People with Disabilities here in Jordan, and you're a co-founder and a board member of the Jordanian Psychological Association. And one of your latest publication is on psychology of radicalism and parents' role in prevention. And I'm interested and I'm really curious now to, and I guess everybody else, to listen from your voices from the ground. Dr. Zuhair, the floor is yours, and we will also have the chance to see you before we will switch to your presentation. Thank you. I think your microphone.
It's open.
Yeah.
All right.
Now we can hear you.
Thanks so much, Stephanie, and thanks for GIZ for hosting this symposium, I would call it, and for hosting me. And thanks for all the colleagues who started before me, because they highlighted many vital points, and I am really glad to listen to the remarkable presentations that they made. Just one very quickly, actually two corrections for the record, because I want to make sure that everything goes in the right way. In the bio, I don't know how this came in, and you just mentioned it, Stephanie, that I work for the General Secretary. I don't work for anybody. I am the General Secretary, unless you want the tax department to start chasing me. In Arabic also, they mentioned that I am tabib, doctor, and this hints to psychiatry. I'm not a psychiatrist. I'm proud to be a qualified and licensed psychologist. Again, the tax department will start searching for my clinic. So please make it right. Okay, I just wanted to make these two things for the record. I hope within the 8 minutes that David told me that I will be having, to make it very quick, some ideas from the ground, as you said, Stephanie. I'm glad that we are now sitting or standing in the grounds. I will make it two parts. I will talk about the persons with the handicap. Actually, I would love the title, The Citizens with the Handicap. What we are doing here in Jordan. First of all, the Higher Council issued in 2017, the new bylaws and the new law actually for the persons with handicap, and it is the one of its kind in the region, because it states very well that people with mental health, let's say, issues or illness, they are considered as handicapped people with handicap or persons with handicap. So they are included within this scheme in order to make sure that their rights will be reserved. During the quarantine and the lockdown in Jordan, the Higher Council was the only official party in Jordan to start tackling the needs of the learners and also the families of the people, of the persons with the handicap. For instance, they started to observe the learners' needs by providing sign language to interpret the lessons that it was, it was presented in different platforms through the Ministry of Education. And actually, this was a great asset for the families and their children. Also, in addition to that, there was a kind of, a well-designed plan to make sure that people that need medication to be brought to them on time without delay, and only these two, not to mention many of other different services. Some guidance also had been given on the through the TV, through the site of the Higher Council itself. And to make it short, I think in addition to this, we are still in big need also to cover more. But this is what the time allowed, the efforts and the resources. On the other side, I mean here talking about mental health psychosocial support for community. I would like just to state that in one educational directorate, 86 school counselors who are working for the Ministry of Education were on continuous contact with their students, each on his or her let's say channel, to give guidance, psychological support, education support, and even assistance for students who are facing difficulties in using the different teaching platforms during the lockdown and the quarantine. In addition to that, I would like also to share with you the following on the level of the community in general. I'm trying to share a document here. This document, can you hear me?
Yes, we can hear you perfectly. I think the document is not seen yet, but maybe it comes.
It will show. Yeah, it takes time to reach you through the cables, because the same happened when we tested David and I. This summary issued by the Jordanian Psychological Association in Amman, it represents many hundreds of psychologists here. I'm going down. Okay, the following summarizes some of the functions that took place. I will leave it to you just to read, and while you are reading, you can give me your ears, just listen to me. I would love that Dr. Musa would stay, because I'm still, I would say that I'm not, it's difficult to say it because this might lead to a war, but I'm not happy with the slowness in applying the strategies that he mentioned. It takes the Ministry of Education lots of time to do that. And luckily, it is the first time that there are a steering committee participated by the Ministry of Education, the Higher Council, and some other entities to make sure that they are, this committee is monitoring the work. The only logical and objective excuse is the lockdown that took place for 80 days almost. But I would like to mention also that without bragging, a colleague of mine and myself, we started training teachers in 1990 on the principles of inclusive education, and we did this for hundreds of teachers, either in Jordan, Palestine, Saudi Arabia, Qatar, Bahrain, and Egypt. And the last one was in Kuwait. The only unfortunate thing that if you didn't assign a person or a committee or a department to make sure that everything will be followed and to make sure that they are paving the way to establish good practices in this domain, things will evaporate. I'm following also now. I'm continuing here. Now we are preparing, and this for my psychological or psychologists colleagues, we are preparing to tackle the situation from psychological and psychosocial support point after COVID. What is expected that people might face in order to be ready for meeting as much as we can of their needs? And I'm saying people, including all persons with the handicap, and also people without handicap. We are expecting lots of demands here, because it will become, for many people, it will become similar to PTSD, although it is not by definition. But after they come out from the anxiety and being bombarded by the media about the virus and the procedures that are taking place in all over the world, now the brain will have a break. Think about the self. What shall I do for people who lost their jobs or who got infected with the virus, or some relatives or beloved ones, for students and children who are away from their schools and from their learning for several months. If we added up August also and July, for some housewives who are, being attacked by anxiety, by panic, by other and also we are expecting that the domestic violence will make a rise because of all the frustration, because all of the disappointment, maybe in the government procedure, maybe in the self itself, maybe in the family members. It takes everything. So if I missed anything, I will leave it to the. I just tried to make it and to cover everything as quickly as possible, Stephanie, and my colleagues on the line. I hope I was clear in that, and this will make my idea clear to you. I just want to say thank you again.
Yes, I have to thank you, Dr. Zuhair. That was really interesting also to reflect what's going on the ground, but it was also impressive to see what was already going on and these sources, of course, you can rely on. I would like to, so thanks again for your presentation. I would like now to turn, I see, I mean, like with one eye, I also watched that a lot of things were going on in the chat. Thank you also, Lilia, to in between also posting what's going on for people that's always like helpful for people to follow on our webinar. So I'd like to hand over now to David and Serene, and I would like to start with David de Batista, who's both are members of our GSZ team Promise, to kind of reflect a bit what was going on in the last 1 hour and 15 minutes in our chat. David, it's you.
Thank you, Stephanie. Indeed, the chat functionality was quite active. And I can summarize a little bit some of the comments and maybe the questions of our participants. I could see that Ayman already, there were some participants who asked for links of resources to be shared. And I saw that Ayman already actually made reference to some of the links, but Dr. Marcio will also later share with us the links of the resources, and we will share these with all the participants. I also saw one comment regarding the inclusive education strategy. We can also later on share again the strategy in both languages, in both English and Arabic. And then maybe I could jump to, I would say, 3 comments, which I found quite relevant to our discussion. One of which was that schools should have trained social workers who can also deal about the cases that we're talking about, but also be part of these referral systems. I think that was quite an interesting comment. Perhaps, I'm not sure if Ayman or Dr. Marcio would like to comment on that later. There was another comment on the school level regarding the training of teachers. And one participant mentioned that teachers should be trained on mental health and psychosocial support as well. This perhaps also can be referred later. And then we also had one comment regarding the expression of affected mental health and how the organization, the participant is working with put emphasis on referring, not to refer to mentally sick. And there are different persons with intellectual disabilities who unfortunately are referred with this term. And it is quite stigmatizing to basically for children to be referred like this. So they put a lot of efforts on raising awareness on the parents and teachers on the matter. Maybe I can hand over to Serene. I guess there were also some other comments in Arabic.
Hello, everyone. Hopefully you can hear me. Well, actually, like the comments in Arabic, there was not a lot. I think it's mostly like written in English, except like couple of comments from Mr. Nader Matarne. He highlighted some terms like that he recommended to use rather than using the term that we use basically. It's related to the well-being because usually like psychological well-being is used for adults, and for kids usually or children like the term the known term is to use as subject well-being, and also like there's a I'm not sure, I think this could be cleared maybe in just like a definition for both terms basically would help. Also, like there's another comment by Mr. Kamal. Kamal, he mentioned like he addressed like that's the translation, the correct translation of inclusive education in Arabic. It's التعليم الجامع, like not damage. That's what's locally used. I think Dr. Musa from the Ministry of Education could answer that question. Also, Mr. Kamal asked a question. What sort of methodology, like in what methodology was used to establish the strategy of inclusive education? Like he mentioned like 3 methodologies used by UNESCO, UNICEF, and UNRWA, that it should be considered while establishing that sort of strategy. Thankfully, like Ayman responded to some of the questions that's already asked by the participants. So thank you for that. And that's it basically for the. Thank you.
Yeah, thank you, Savine. And David, there was like some question you wanted to direct it to the Ministry of Education, if I'm not mistaken.
There was one regarding the budget, if I'm not mistaken. I will, sorry, I'm searching for it.
Yeah, I think I remember that one. But because it was like in the beginning also, I guess, like also when we had the framing of the inclusive education strategy, showing again, like if there's a budget, you know, like which would be allocated for a school to be inclusive. And I think that's a really tricky one, isn't it? Like, because it really depends on the circumstances and the surrounding circumstances, but then also the individual school. But I also think, well, what also I took away this today, of course, is also to also then see how large can the package be, and especially like now again mentioning how important psychosocial support is in teaching and learning. And that's, of course, it's also in the end it will cost something, but I'm very sure this is like it will have a long-term effect, so the cost will be well spent. But I think like it's really difficult to give like an answer which yeah, even for the Jordan context, it's something which is difficult to tell.
We had another question, Stephanie, more of a practical question. The question we received it via email: what can be practically done to support education practitioners, such as teachers, to support their students who need psychosocial support or further support? Perhaps this is again more on the practical side, but maybe Dr. Marcio or Ayman are happy to answer this question.
Yeah, I think that would be a nice question also for closing, like that each of you say something. What do you think would help teachers to support psychosocial well-being of students? Huh? Maybe we can have a little round. Marcio, maybe you can start, and then Ayman, and then also Dr. Zuhair can tell that one for the especially specific for the Jordan context.
Sure, thank you everyone. So thanks for this question. This is the golden question, the core question of this presentation today, or this discussion. I would answer that giving a wrap up in three key take-home messages. I hope you can have reflect a little bit more during this presentation. First, that well-being matters. And second, that your well-being matters. So it's important that that aspect, and that this presentation can have contributed to you to feel empowered to act in that direction of well-being, not making it a hidden subject of discussion, even for yourself, but also with your colleagues or in your general lifestyle. But can be a normalizing kind of discussion, because more we can speak about it. Speaking is a way of elaborating the whole experience. Sharing is a way of elaborating and helping to control the anxiety, the fears. Social connection is one of the golden aspects of finding as a source of motivation, of support for ourselves. Social connection. It's interesting because social connection during this time of physical distancing, we need to be creative to new ways of increasing social connection. And there are several small elements about that. One is really increasing the number of calls and connections, and thanks that today we have all these social media way of connecting to people around. But I have changed recently my work style, because I spend 8-9 hours here in my office having meetings around the world. And I start to always use the webcam when I connect to people, so I can see and have a sense of connection to people that I see can't see face to face, but I can see their face and their expressions. So those are small things, and we could put here a long list of ways of coping with that, and the documents I shared with you gives them to you as well, several suggestions in that sense to support your own well-being and also to empower you to support the well-being of others. But it's also a question for yourself, you know, having this as a driving commitment, the well-being. What can you do to understand that social connection is important, and being creative is important, the well-being of your own well-being and the well-being of others is also important. What help, what doesn't help, you know, it's very personal. And this kind of discussion about self-help is not about teaching persons, it's about reflecting. So, and it's challenging because reflecting about those things in such a short period of time, yes, it shakes us a bit and help us to remember that well-being matters, our own well-being matters, but it's also very challenging because we should go deep and help to get from our, in a very personal way, how to cope with that. And to finish here, it's also okay to not feel okay. Remember that. So it's a moment to balance strengths and vulnerability. Don't get into the hero mode. That is the most dangerous. It's the clashing mode. You know, if you go to the hero mode, you deny your own needs and say, the others are the one that I need to help. They need more than me. And you go to the hero seat drive. I can tell you, the final road of that is clashing really badly. Okay, so the step back of it is taking out the idea of being a hero, but being a human. It's balancing the times of strengths that we can have, you know, and there are sources for it around us, but also acknowledging the times of vulnerability. It is okay to not feel okay. Thank you, everyone, and I hand over to Ayman and back to you all.
Okay, thank you, Marcio, and Ayman, it's your turn.
Thank you so much, Marcelo. That's very interesting remarks, and there have been a lot of questions, which is very much interesting to address, and that's why I often like this part of the webinar, the Q&A, rather than my presentation itself, because it really sees that you know, the voices from the ground and the questions that every educators and teachers go through that needs to be addressed. There are a number of questions that unfortunately I don't have time to go each one of them, but there is one interesting question from one of the participants who basically said, "Oh, we need social workers probably to be part of the school system, you know, and to be part of the leadership inside the school." And that's basically a very legitimate and very valid point. But what I would like to emphasize here is that this is also one of the assumptions that there is nothing we can do because we don't have social work experience or mental health professionals at our schools. I think there is always something that we can do here. Can you hear me now? Because I was hearing an echo for my voice. What I'm trying to say is that there is always something that we can do here, even if we cannot find a solution that we think that should be comprehensive as we would like it to happen. What I wanted to say is that the lack of experience in mental health, in social work, this is a problem worldwide, not only in schools or in health services. It's across the society in general. I live in Australia here, and there is a new research says that there is a high number of students in Australia with mental health don't have access to professional care, and that we need better understanding why these children are being missed out. For my colleague who raised the point of why don't we have a social worker, what I would like to advise you practically here is that there are steps that can be taken in conjunction of the inclusive education projects that is happening inside your classroom, that is happening inside your education environment. For example, many projects are connected to local community-based rehabilitation, the CPR, which basically help learners with impairments and mental health conditions to access rehabilitation and medical support, which basically enable them to join education, employment, and also have several aspects improved in their life. I know very well that teaching can be very stressful profession, and teacher can face a tremendous amount of pressure, either like delivering results or ensuring that learners could pass exams, or help students to satisfy their parents, and so on and so forth. There are constantly those teachers being asked to cope with a new curriculum or material, and to deal with never-ending flow of new learners who each bring unique needs and problems in their classrooms. What I want to say here is that this might mean that ensuring there are mental health referrer. What I'm talking about here, the referrer, the collaboration between the school environment, the parents, the local community organizations, they got to get out of the school. The school should not be only limited inside the school. You know, the interaction should the communication should be always maintained between the schools, between the local community, between the CPOs, and there where we can find that social worker, where we can refer that students with mental health issues to the local clinic, and to maintain that communication with teachers. It's very interesting conversation. I really would like to have more time to do that, but what I'm trying to say here is that, and I would like to conclude here, is that we can reframe this difficult time and consider it as an opportunity to connect, as Marcio has said, and to care for each other, and to build the bridges and network and collaboration between the school, the local community, the parents, the school leadership, and to be innovative, and so we can all move forward to more inclusive practices where teachers and students can all thrive. Thank you so much.
Yeah, thank you, Ayman. I can see you really have a lot to say with all the experience you have. But I know we run a bit late, and I hope still some of you bear with us, because I wanted to give Dr. Zuhair also the opportunity to say something to our last question. What is it like you think, Dr. Zuhair, would you recommend, especially for the Jordanian context now, to ensure psychosocial well-being in teaching and learning?
Well, if you mean among the schools environment in general, yes, I believe every teacher can be a role model in creating sense of safety among students, and to deal with the negative ideation that they might face, not the teachers, I mean the students. I think they are the most skillful people in identifying the students' needs. So, what are we doing? Do we need a miracle here from the sky or elsewhere to bring our kids and our learners kind of psychosocial support in their daily lives? Every teacher can do. We are not talking about teaching. We are not talking about applying tests or making, MPIs or whatever testing or applying things. More everyday.
I can hardly hear Dr. Zuhair.
Dr. Zuhair, your voice is a bit cracky. I don't know if it's like the microphone. Sorry. Yeah.
Maybe is it my microphone? It's
no.
okay.
Now it's better. Now it's better.
Maybe I was a little bit close. Okay, I will say it again. In the schools, we have teachers, we have cadre, a great one, not only in Jordan, in every country actually. teachers are devoted and they are, they are loyal. 90% of them are loyal to their profession, and they are the most skillful people in identifying or taking these three major roles that I've mentioned as part or one of the pillars for the psychosocial support in any environment, in any community, whether a school or neighborhood or wherever. Now, in school, they have to make sure that every student feels safe. Every student is being dealt with his or her negative ideation, especially through the crisis situation. And my colleagues here, Ayman and Marcelo, know what crisis could be able to create inside the humans' selves. And the third pillar is to make a great help of identifying the students' needs in crisis situation. If I need to spread something positive in a school or community, I would go directly to the teacher, him or herself, make sure that he or she knows exactly about her students or children that she is teaching or is teaching. So as the misconceptions and misassumptions that Ayman presented to us, this adds, teacher is the key to inclusive education. And the collaboration with the families is another key here. I hope this made my point clear.
Yeah, thanks a lot, Dr. Zuhair, and thanks a lot again to Ayman and Marcio. Dr. Zuhair, maybe you can switch off the microphone now.
Oh, yeah.
Yes, because sometimes then it's otherwise creating an echo. Thanks again for this closing round. And I don't want to prolong it with another closing of my side, but I took a lot. I had a lot of notes also written down during your talk, and thanks a lot also for sharing a lot of your resources already in the chat. We will also share the presentations later on. There were a lot of links also mentioning by by Ayman and Dr. Marcio, but also we will share what Dr. Zuhair has mentioned, that supporting support programs which already exist in Jordan or should further be built on. So I think like it became very clear, and I think like nobody of us experienced a time where really the well-being and the mental health is like affected. So many people are affected, and I mean we all feel it, and I think that's a very specific situation. And I also see what Ayman has said, like that's also a chance. There lies a lot of opportunity to again highlighting a topic which has been important even before that, and will be important also in the next months and years. And also I like to quote what you have said, Dr. Marcio. Yes, we don't have to be heroes in that. And it needs a lot of people to support and really, to also to see where support is, and support is not always only in the school system itself, but also in the surrounding that has been mentioned as well. So I like to close our second webinar on ensuring psychosocial well-being in teaching and learning. And I like to advertise a bit our third webinar on the 22nd of June on the topic of practical approaches to support all learners in their education at home. We will have again interesting speakers during this webinar. The invitation will be sent to everybody a few days beforehand. And in order to continuously improve our webinar series, it would be great if you can take 2 minutes of your time to fill up the feedback form. And David is sharing, or did already share, the link on where to find the feedback form. David, if not done, please just like post it again so that everybody knows how to give us the feedback. And if you don't want to use this question form, then you can also send us an email. So it was great to have you today. Again, a special thanks to all our presenters and also the Ministry of Education and the Higher Council as co-partners in this webinar series. And thanks to everybody who even stayed till now, because I know we're a bit over time. I hope to see you to our next webinar too. Bye-bye.